Let's talk about the hormones of the pituitary gland. There's seven you want to know for the anterior pituitary, and two you're going to want to know for the back, the posterior pituitary. There are a couple ways to memorize what hormones belong to which, but the easiest way to remember is to use the acronym FLAT-PIG. FLAT-PIG, so F for FSH, follicle stimulating hormone, L for luteinizing hormone LH, A for adrenocorticotropic hormone, T for thyroid stimulating hormone, P for prolactin, the I is irrelevant, there's nothing there, and the G for growth hormone. FSH, follicle stimulating hormone. These act on the eggs for women and the testes for men. For the eggs, you're going to get stimulation of the follicles, so to release, and develop eggs. Sorry, not release. And then for the testes, it stimulates sperm production. Luteinizing hormone, that's a different gonadotropin. Basically, it's going to stimulate ovulation. Thyroid stimulating hormone, those are going to be secreted by the pituitary cells, and they're going to stimulate the growth of the thyroid gland and the secretion of the thyroid hormones. Adrenocorticotropic hormone, ACTH, that is basically going to be secreted by the pituitary cells, and it's going to stimulate the adrenal cortex, which will then, plays a role in regulating glucose, fat, protein metabolism. Prolactin, that is basically, you'll see it rise during pregnancy, and then it basically stimulates the mammary glands to synthesize milk. Growth hormone, so GH, basically that's going to have roles in protein synthesis, lipid metabolism, carb metabolism, and electrolyte balance. So those are the hormones you're going to want to know for the anterior pituitary. For the posterior pituitary, there's only two, ADH and oxytocin. ADH is I would like to call it like an antidiuretic because it stimulates the reabsorption of water back into the blood from the nephrons. So, if your BP is low, you're going to see some ADH present to get that volume back up, so the pressure goes back up of the blood. Oxytocin, that's going to have roles for, reproductive facets. You're going to see it stimulate smooth muscle of the uterus during contractions, so when the baby's trying to come out. And you're going to see it playing a role in the propulsion or movement of semen through the reproductive tract of men. And those are the hormones for the pituitary gland.